Okay, it will take a few minutes time only
Sure, sure,
for going to live streaming.
sure.
And I would ask my panel members, we are going to tell me how we are going.
What's up?
Good morning, sir.
Now, I would request all the panel members who are present on the platform Zoom to kindly mute themselves because we have already gone live to YouTube. And I will be the moderator now. So I will ask the people to unmute themselves one by one, the speakers and the panel members as well. All the panel members who are present on the platform Zoom to kindly mute themselves. तो बच्चों को बोल दो कि उससे चालू हो गया यूट्यूब से प्रोग्राम लिंक शेयर करो तुमको ये लो फटाफट डालो तो
Mr. Rahil,
यस
actually, few of my colleagues and all whoever registered, they are saying कि this is not means they are not unable to access this thing.
आई
So
एम
how can
सेंडिंग
I?
द लिंक आई एम सेंडिंग द लिंक टू यू ओके आई
Okay,
सेंड द लिंक टू माय
okay, okay, okay. सर एक वेबिनार चल रहा है तो मैं वो रूम यूज कर
Hello, I have shared the YouTube link in the chat box as well. If people are unable to join through that particular link which we have sent through the mail, I would request to the staff of our college and to the speakers that they can send the link. They can copy and send the link to people, and we are already live on YouTube. Okay, so people are joining now, and I guess we should not waste our time because time is really important. So we are starting now the session. Fine. So very good morning to all the people who are joined with us. And today we are celebrating the Pharmacist Day. Today is 25th of September and we are celebrating Pharmacist Day at Jamia College of Pharmacy, Akalkua. Along with us, along with me, we have various people over here. We have our principal, Mr. Mohammed Tariq, the college principal. We have very eminent speakers from Bhubaneswar, Mr. Santosh Kumar Naik, as well as we have one speaker, Dr. Professor Anthony, who is from Philippines. Professor Anthony, I would like you to please switch on this thing, your video. And this is Mr. Mohammed Tariq, who is also here. I would request Mr. Zaimullah Inamdar sir to kindly start his video so we can see him on YouTube as well. And Professor Anthony Marine from Philippines. We are all live on YouTube now, and we have a very good audience over here. And without wasting the time, I would like to introduce our first speaker for today's webinar. The theme of this particular event of Pharmacist Day today is Transforming Global Health, which is given by Pharmacy Council of India, which is the upper hand body, regulatory body, educational regulatory body in India, which regulates the education, pharmacy education in India. So according to that, we are also celebrating the Pharmacist Day as transforming the global health. So now I'm going to start sharing my screen quickly and will introduce Professor, and I would request all other panel members to kindly just switch off their cameras. So the first speaker is going to be Professor Anthony Marine, all the way from Philippines, is going to
Good morning, Mr. Rahil. Rahil, can you hear me?
Yeah, yeah, Professor Anthony, I can hear you. Your
Okay.
PPT is just starting,
Okay,
and
thank you.
I've already shared my screen. So I'm just going to give a small introduction of yours because if I'm going to give a full introduction of Professor Anthony, it will actually entail a full-length libretto. So and we don't have that much of time to introduce Professor Anthony, who's all the way from Philippines. So I'm just giving a small introduction of Professor Anthony, and then I'm going to hand over the uh, things to Professor Anthony. You can just tell me when to switch on these slides. So I guess now your PowerPoint is there on, I think all can share, see the PowerPoint presentation of Professor Anthony now.
Okay, thank you so much, Professor Rahil. Um,
Okay.
okay, so
One second.
namaste, namaste. And the essence of global health equity is the idea that something so precious as health might be viewed as right. To the President, JIIEU, Patron Maulana Ghulam Muhammad Vastani, to my co-keynote speaker, Dr. Santosh Kumar Nayak, the principal, Muhammad Tariq, Jamai College of Pharmacy, deans, faculty and staff, the organizing committee of this event, to Professor Rahil Khan, thank you for inviting me, the pharmacists, the pharmacy students,
Welcome.
ladies and gentlemen, good morning, India, and good afternoon, Philippines. It is my honor and privilege to be with you today. Before I will start, I would like to greet everyone a happy World Pharmacist Day. And I would like also to greet my BS Pharmacy students from St. Dominic College of Asia in the Philippines. Professor Dr. Irene Rocco from Kingdom of Saudi Arabia, King Saud University College of Nursing, and other school or university who participate in today's webinar. Good day to all of you. My name is Professor Anthony Rios Marin. I am the program chair of the College of Pharmacy and School of Health Science Professions at St. Dominic College of Asia in the Philippines. And my topic for today is responding towards challenges of COVID-19 pandemic, the pharmacist perspective. Next slide, please. The St. Dominic College of Asia caters a different program, School of Business Science, School of Arts and Science Education, and the School of Health Professions. That includes nursing, biology, medical laboratory, physical therapy, radiologic technology, biology, and of course, BS Pharmacy. Next slide, please. So now I will, next slide, please. Now I will tackle about the challenges of the pharmacy in the community and hospital pharmacy, manufacturing pharmacy, and the pharmacy education. Next slide, please. As we all know that pharmacists all over the world modified their practice amidst COVID-19 pandemic in order to guarantee care, support the patients. We as a pharmacist in different area are facing a spectrum of challenges to surmount and to ensure patient care continues. This includes assisting in prevention of the infection, managing supply chains and preventing stockpiling and provision of the evidence-based medication information. Okay, for the introduction, as we all know that the COVID-19 pandemic is placing an extraordinary and sustained demands on health system. The media also focused on the number of the cases, intensive care units capacity, and ventilators number. And also, of course, we are always, I would say, waiting for the updates of the vaccines and the economic problem of country. Pre-existing community care needs persist, and medical and pharmacy practitioners had to adapt professional role changes amidst the dynamic health care system. Next slide, please. Okay, so I will start with the challenges in the community pharmacy. These are some challenges that pharmacists encountered in the community. First is the patient with a mental health conditions, government or regulatory office, and then the health system administration. Okay, the other challenges for the community pharmacies was protecting their staff and patients from the spread of the infection in the pharmacy. Patients adapted their premises to try and to achieve social distancing by installing the barriers or a doorway booth, restricting patients' number. There will be a limited number only that you can enter inside the drugstore. And just to access and implementing the delivery service. Next slide, please. So we will check one by one what is all about the patients with mental health and some challenges. Okay, for that, mental health and first aid. This time, actually, it increased the level of anxiety. Okay, affect the poor and also vulnerable populations. Heightened anxiety and stress level among pharmacists highlighted recently by the Ministry of Health or the Department of Health due to the increase of the workload. And community pharmacists are trained in mental health first aid, and they may play a role in providing the advice to patients. And for the stress management, people are stressed because of the threat of infection and also the financial implication that will be additional stress. And that is why everyone, managing feeling of everyone, or sometimes, mostly they feel that they are isolated, and providing evidence-based information, that will be the role of the pharmacist. And there will be an increase of dispensing of antidepressant drug, and we all know that it causes high risk of overdose. And for psychological support to patient, for person in treatment, one of the biggest threats is disruption of care, particularly in the access of medication, smoking behavior, and emerging poisoning causes. Also, during this time, because like for example, in the lockdown, and now we are in a lockdown, it increases the second-hand smoke exposure to the family members. That is why pharmacists have the opportunity to initiate smoking cessation treatments when access to other healthcare professionals. Emerging poisoning cases are also included, mostly related to poisoning link with disinfectant and hand sanitizer, especially for children. Next slide, please. For the government and regulatory, these are mainly the challenges in the of the pharmacists in the community. So previous slide, please. Government and regulatory. Previous, please. The previous slide, please. Yeah, okay, that's it. So for the government and regulatory, that will be an additional, I would say additional challenge to the pharmacies, because it means that the pharmacies have to respond quickly to the pandemic. Regulatory and health system changes occurred at the unprecedented pace. For example, changing or develop a new implementation and policy or guidelines and need an emergency restoration process to allow the former registrant or re-register and to follow the guidelines given by, for example, in India, the Ministry of Health or the Department of Health here in the Philippines. And there will be an introduction also of the electronic prescription. And some drugstores accept it through email and transport system enabling email prescription. It causes to removing of the legislative requirement of the paper script. Maximum validity to prescription increases, and there would be an increased amount of repeated prescription, and so sometimes dispensed in full. And for the emergency supply of the control drug, expanding emergency supply, increase the number of days, as well as the increased number of days, and that they can be supplied. Next slide, please. Okay. Another challenge in the community is the health system administration. Of course, medication shortages. This is normal. Actually, medication shortages due to lockdown, and it will affect the management and the guidelines. And provision of guidelines. I would say that the provision of guidelines in the pharmacy, contingency planning, and risk services, just to follow the government rules and that they have to impose to the pharmacies or the pharmacist owner. And reimbursement claims and condition. As we all know that during the lockdown, reimbursement of under the community drugstore is really hard due to lockdown, of course. And for example, they are paying through credit card, so that will cause delay of the payment of the medicines. Next slide, please. Okay, so let's proceed to the challenges of pharmacies in the hospital setting. Caring for hospitalized COVID-19 patient is a resource, intensive, and requires substantial hands-on attention from everyone in the healthcare system. So I would say that we will check first with the pre-COVID patient, sickest of the sick, and then leaving the hospital. Next slide, please. What do you think? What do you think would be the responsibilities of the pharmacist here in the hospital setting? It means that the pharmacist will be able to provide medicines needed by the patient and to maintain the life-saving medicines in the emergency room or in the ICU. For example, the fentanyl, that considered as the safest and the most effective three main opioids used in the care of the COVID-19 patients. And the pharmacist must consider the complication as well as carefully determine the drug dosage. Pharmacists must also regularly check the stock available, and it's a challenge for the pharmacists how to provide the medicines during the patients are fighting for their lives. That is why I will discuss with you the pre-COVID patients, which there would be an increased number of patients, and that is a challenge to the pharmacist. The sickest increased number of patients means that increase the demands of medicine. Okay, delivery of medicines will be a challenge to pharmacies, and also the logistics supplies. That will be under, the purchasing department of the hospital, and the hospital on how to provide all the medications that they need to ensure providing quality care. And sickest of the sick, it means that the pharmacies remain critical responders during emergency, and especially for the code red situation. And make sure to give the medication by identifying appropriate medication and dosages to control the pain and agitation during intubation procedures. Pharmacy's challenge is more complicated by the process of drug shortages. Um, Mr. Rahil, I think we lost our PowerPoint. Previous slide, please. Previous slide, please. Previous, please. The previous slide. In the hospital pharmacy. Please go back to the hospital pharmacy. Mr. Rahil, can you hear me?
Yes, I can hear you. Is the slide?
Yeah,
Is it
yeah. The previous slide, please. In the hospital pharmacy.
this one?
No, yeah, that's it. That's it. Okay. So thank you so much, Mr. Rahil. So I will continue. I will continue with the discussion that the pharmacist work closely with the nurse and the physician to recommend the medication and manage the sedation targets and the safety and just to adjust the dosage basis of the individual patients. So that is why it is a challenge for pharmacies on how to provide the quality care, especially for the sickest of the sick. And leaving the hospital, leaving the hospital is a miracle, considering all the complications that the patient suffered. Uh, all hospital staff are, of course, happy, and of course, including the family. But for the patient, there would be a stress because of the stigma. Okay, next slide, please. Okay, so now I will discuss the challenges in the manufacturing pharmacy. Pharmaceutical industry being valuable industry facing through challenges to conduct its business activity. So we have the ancillary supply needs, workforce disruption, and technological solution. Next slide, please. For the manufacturing pharmacy, the challenge here are supply needs, workforce disruption, and technological solution. So, as we all know that China is one of the largest active pharmaceutical ingredients producer in the world, and as of today, we cannot determine the impact precision of the volume of API, as we all know that India is one of the largest supplier of generic drug worldwide, are trying to minimize the scarcity of the essential medicines. So importation of medicines is worse, affected by the COVID-19, and it causes shortages of medicines and medical supplies in the other country. And for the workforce disruption, implementing of remote work solution or a social distancing of employees causes delay of work as well as the quarantine of personnel permitted to enter in the facility, and there would be a limited workers. It means that cannot fulfill the demands or due to the day or the due date ordered by the pharmaceutical distributor. For the technological solution, there will be an additional challenge for the manufacturing pharmacy. Employees sponsored telephonic solution that cost additional burden to owners or the pharmacist owner, including updating of the contingency plan by a challenge of the manufacturing pharmacies and the manager and staff. Next slide, please. Next slide, please. Okay. Uh, the previous one, the previous slide. For the challenges in a pharmacy education, learning never stops. Okay, it is a challenge for the pharmacy educator on how to provide quality education and to cope during the pandemic. These are the following challenges that the School of Pharmacy addressed. Here in the Philippines, I would say that the Philippine Association of the College of Pharmacy, that is the organization of the colleges or the School of Pharmacy all over the Philippines. So we address the problem in the research, the internship, the pharmacy internship, and the laboratory classes. Next slide, please. Okay, so we will check one by one. For the pharmacy education, as we all know that mostly experimental research was conducted and performed in the pharmacy research. And so it is a challenges for the faculty on how to conduct laboratory experiments. That is why we switch to a descriptive and quantitative type of research. And for the pharmacy internship, we have the community, hospital, and manufacturing internship. The Philippine Association of the College of Pharmacy actually organized a meeting and a seminar on how to conduct the pharmacy internship, and immediately produced a guidelines that the faculty of the College of Pharmacy follow that guidelines. And another challenge is laboratory classes on how to conduct laboratory during this time. So the same also, the Philippine Association of the College of Pharmacy, because it is a challenge on how to perform the laboratory experiments. And that is why they organized the seminar and the training to the pharmacy faculty on how to conduct virtual laboratory experiments. So I think I already discussed the challenges in the different area in the community, hospital, manufacturing, and also in the pharmacy education. And I hope that you learned something today. And again, thank you for inviting me. God bless everyone and stay safe. Hail Pharmacy. And thank you, Jamai College of Pharmacy, for inviting St. Dominic College of Asia.
Thank you very much, Professor Anthony, for delivering such an in-depth knowledge of pharmacy education, pharmacy, hospital pharmacy, and the role of pharmacists in different categories in Philippines and internationally. So we are really grateful to you, Professor, and we are quickly shuffling now towards our next speaker, Mr. Santosh Kumar Naik. So I'm introducing him, and after that we will have a panel discussion. And after panel discussion, we can take some questions from the members. So, very quick introduction to.
Thank you so much.
Yeah, thank you very much, Professor Anthony. So I would like to invite Mr. Santosh Kumar Nayak. Mr. Santosh Kumar Nayak is having over 10 years of experience in the field of pharmacy. He's a clinical pharmacologist. He's postgraduate in the pharmacology from one of the best universities in India, called Shiksha Anusandhan University, which ranks 20th in the NIRF in 2020. And he's the clinical pharmacologist right now at Ambry Hospital, one of the finest hospitals in the eastern part of India. Started its journey from Kolkata, and now they have also established the largest hospital in Bhubaneswar. So I'm just going to quickly share my screen and all over to Mr. Santosh Kumar Naik.
Yeah, thank you, Mr. Rahil. And first of all, hello.
Yes, Mr. Santosh Kumar.
Thank you to all management of the Jamaica College of Pharmacy for inviting me as the keynote speaker. Thank you, the all coordinator and Mr. Rahil for inviting me. And Jai Jagannath, I would like to start the theme of this World Pharmacist Day, transforming global health. Really, We are in the form of transforming global health. And first of all, I want to thank you, all the pharmacists, and I want to welcome the 10th World Pharmacist Day, which is celebrated on 25th September of every year. And also welcome to the third largest healthcare professional, that is the pharmacy profession. And still now in the India, we have already 10,000 10k 10,000 registered pharmacists all around the India. So in the pharmacist day, which is celebrated on the 25th September, is hello, is this audible? Hello,
Yes, Mr. Santosh, you are audible.
my video also visible, no?
Yeah, your video is also visible.
Okay, so in India, PCI has announced the official observing for the pharmacist day on 25th September, and it takes place means with effective from the 25th September 2013, which is celebrated in every year. So can you proceed? Next slide, next slide, please. Next. So the next slide, next. Uh, Yeah, the role of pharmacist actually it is invaluable. Means it is more valuable than because in any emergency situations, the pharmacists their work very tirelessly, very effortly, very outstanding dedication, and always in any of difficulties time, like you can say this in the COVID time or any crisis time or uh, every time the community pharmacists stand with their for their patients. Next slide, please. So today I'll discuss the whatever the scopes. Next slide. The scopes for the pharmacist. What means the scope? It is listed like teaching professional, R&D, research and development, regulatory pharmacy, industry pharmacy, community pharmacy, hospital pharmacy, as a entrepreneurship, and many other professionals which can be a pharmacist can join and uh, show their capability. So next slide, please. I'll describe all these whatever these opportunities in the pharmacy graduates, like all we know the production, marketing, research and development. So I'll briefly describe in the production section, starting from the formulation, bulk drug, cosmetic, OTC, excipients, intermediate, and all packaging, everything the pharmacist can join, and they can prove their capabilities on this. And marketing also, there is so many scope on this: sales marketing and marketing management, campaigning management, promotional strategy, advertising, production management, and very booming scope is like in the business development. It is a very big scope where the market research is started, and from the market research they can be provided the whatever the company can gain, or whatever the company can miss, they can project it how the new product can be launched or everything. Then research and development, as you know, for the discovery of new formulations, new molecular and a biotechnology or herbal or tissue culture, whatever thing the pharmacy graduate is very needed on the research and development. And for the clinical research, it is a very wide scope for the pharmacy graduates, like in the pharmacovigilance, from the starting from the research and monitoring of the trial, regulatory affairs, medical writing, and clinical data management. Nowadays, it is very wide scope, and like no, in this scenario, the more demand is like in the clinical research. So. Nowadays many number of clinical trials they are focused on the India also. So this is a very wide scope for the pharmacy graduates. Then apart from the hospital, they're like operation room means OT pharmacist, drugstore pharmacist, then community pharmacist, and health hospital pharmacist. So from that the role is like in very as the pandemic of COVID pandemic is suffering from all the world, the role of the pharmacist is very crucial. Like the source of means the for the treatment of the medical means for the COVID is very limited. Like from those, from additionally few other medications also. So for this, the role of pharmacist, how it is important for the storage of the medication to from the documentation, because it is comes under regulations. So in that regulation you have to keep all the documents whatever the as per the DCGI or the DI, mean that documents have to keep very systematically, otherwise they cannot supply the medications. So the role of pharmacist in a pharmacy or for hospital pharmacy, OT pharmacy is very crucial. Okay, next slide please. Hello. Yeah. And as a also in the critical care or nuclear pharmacist, it is like nuclear pharmacist you have to image, you can be in imaging centers, radioactive diagnostic or a radiopharmaceutical, radiation safety and dispensing officer. And in the you might have some, known about the analytical quality control in the many production or any other sector. Also QA QC department is very important, and from that the pharmacist plays the specific department. And the without this quality control, the product or the product is means someone the quality product is ensured on this. So pharmacy graduate is very crucial on this. Next is for academics, as in the academics, the teaching sector, the teaching and research, higher studies like doctoral, postdoctoral, master MPharm, and MS, MBA, LLB, doctoral, then bioinformatics, or IPR and regulatory affairs. This department is very booming sector. And next is material management. In the it is for a running of the hospital or organization, the material management is very important, like stores, warehouse, production planning and inventory. So they plays the vital role in the this segment. Next slide please. And in the regulatory like government associated drug inspector, IPR, and drug registration filing, forensic department, and like other department like auditing and all, everywhere. Then food industry sector, all these things the pharmacy graduate they have the knowledge how to um, regulate all these things. So the vital role in the pharmacy graduate in this sector is very important. Then as a consulting, here I want to discuss, if once you are a expertise on what means in your sector, like method developing in, even if sometimes what happen, the few expertise they means organization they are demanding for the experts, you can as a work as a consulting. So you will go for their problem solving and solve the problem and get the handsome money. So in the data processing and project handling also, the you can be hired as a consulting. And also drug information specialist, it is a like database research or data development, back insert, scientific literature reviewer, everything. If you will go the any medication part, whatever the means mention, like the how to take, how means when to take, posology and everything, that is prepared by the pharmacist. Uh, so then all the government jobs like in the government hospital, government analyticals, and in the ICMR or CDRI, everywhere in the pharmacist in means paramedicals, not in the paramedicals like Navy, Army. Uh, they plays the vital role. Then in if I said in the opportunities in abroad, like all in the research, academics, and drugstore pharmacist, as a pharmacy manager or higher education, as a consultant or industry in a QA QC production, a, you can get a chance in the abroad. And this is only means in this professional start the retail, wholesale, loan licensing, testing lab, and in other sector like medical transcription, technical support, project management, logistic, supply, and journalism. All this sector you can be entered and the farmers graduates. Next, in this, I want to focus one more thing, the role of the clinical pharmacologist and pharmacist in the corporate hospitals. In a corporate hospitals, the pharmacist role is means clinical pharmacologist or pharmacist role is very vital because in the term we're saying ki we are transforming the global health. As many of the corporate hospitals, they are getting the uh, they are doing the quality of service. So in global level, like they're accredited with NABH hospitals, okay, or JCI hospital. In this case, they need to maintain the quality of service. So in this case, there is so many things associated. So a clinical pharmacist or clinical pharmacologist can handle all this, like issue related to medication in corporate hospitals, problems like if there is any changes in the medication, if the route frequency or dose, everything is there is any changes or any wrong, then the pharmacist can suggest a doctor or they can guide to a nursing or they can train to the pharmacist or doctor. So regarding the medication related problem or medication error. So even if in this case they can prevent the medical legal cases. And in the drug ADR, adverse drug reaction monitoring, they plays the vital role. They're reporting the PVPI pharmacovigilance program of India for the whatever the ADR happened to the patient, so that the data can be compiled and the data can be, and so it can be used in the further for the benefit of the society. So and there is a huge role of the clinical pharmacist or pharmacologist in the monitoring of the therapeutic drug monitoring in the as a drug information center. So in the drug information center, majorly the doctors are followed. They are asking for this patient if there is the as per the lab report, the patient having the this much of creatine clearance, this much of the condition is this. So what will the dose? So the role of clinical pharmacist is here to guide what should be the dose of a for the patient. Then and another major role is periodic auditing of prescriptions in the hospital. So in the if you audit the file, in that you can get what is the means you can prevent the unethical or you may say how can the patient will get the medication, like in the antibiotic, the days will be fixed, the dose will be fixed, whether they are ethically they are getting that medication or not. And as a role in the participate in the clinical trials. So a clinical pharmacologist is very technical on the knowledge on the research and all. So they can see the ethical issue or safety issue for the trial. And next role is a member of a drug and therapy committee. This committee is like a, whatever the new drug or whatever happened in the um, hospital, that should be informed, and what should be the steps should be taken for that. It all will be discussed in the meeting. Pharmacist play vital role in this. And apart from that, drug utilization, then new drug purchase, and for the analysis of the medication, ABC analysis. There is so many of quality parameters, high risk medications, look alike, sound alike drugs, and like narcotic consumption. How to document all these things? There must be a pharmacist or registered pharmacist who can handle all these things. So this also. mm, can we proceed for next slide? Yeah. So in conclusion, I can say pharmacists must participate in the endeavor to shape their role in the global health by changing their perception towards the type of service they can provide, not only in their respective local areas but also at the global level. So again, I want to heartily thank you all the pharmacists in the 10th Pharmacist Day, this World Pharmacist Day, and also welcome to the world of pharmacists and to the students whoever in the Jamia College of Pharmacy or all over the world. And I want to heartily thank you so many of COVID warriors and COVID pharmacists who already very tirelessly work in the in this pandemic situation. And thank you the management of Jamia College of Pharmacy for inviting all this, and thank you Mr. Rahil. And I think I covered uh, very briefly and so much of actually the pharmacy world is very large and very wide. So thank you.
Thank you very much, Mr. Santosh. It was an amazing, in-depth presentation regarding what actually the pharmacist should do here in India and what are the different opportunities for people who are actually going to become the future pharmacists. So right now we are going to quickly wind up our session. Before winding up our session, we should have a kind of panel discussion, and I would like to both the eminent speakers, Professor Anthony and Mr. Santosh Kumar Naik, to join us. I would also request the principal of the institute, Mohammad Tariq sir, and also Mr. Zaimullah Inamdar sir, who is the academic in charge of Jamia College of Pharmacy. Please join the discussion. Uh, I would like you to start your videos, Mr. Zaimullah Inamdar sir and Mohammad Tariq sir. Okay, so a very quick question to the panelists who are here. So Mr. Santosh Kumar Naik, Professor Anthony, Mohammad Tariq sir, and Zaimullah Namdar sir. We are just going to discuss certain things which are quite essential for the upcoming pharmacrats in this challenging world. As we are moving towards transforming global health, and this particular burden is going to be on the shoulders of the upcoming pharmacists, the challenging world. So my particular query and my particular question over here arises as a student over here, that what qualities and what skills should the current students acquire as well as the book or bookish knowledge which are taught in the institutes and schools of pharmacy and colleges. So apart from that, what skills should the pharmacist acquire, okay, to be productive and to be effective pharmacist in the challenging world like the pandemic situation we are facing right now. So I would move towards to Professor Anthony first. Yes, Professor Anthony, please.
Okay, I think because now we have the pandemic in this time of pandemic, I think the only advice that I can give to the students are they have to face the reality. They have to be very strong, and at the same time, not only that they have to stick with like for example BS pharmacy, they have to continue, continue of learning, learning the skills, and at the same time improve that skills. And the time will come that will be a drive to, I would say, that will give them a drive, a better future. And at the same time, it will give them the, I would say, more knowledge and skills to be a better pharmacist. Okay, because as time goes by, it is not only that you will learn from the book. Experience is one of the best, that you can learn from it. The actual learning is the very important. So I hope that the students will do that and will continue to learn and don't stop to learn. Okay.
Thank you. Thank you very much, Professor Anthony.
Thank you.
Now I would move towards Mr. Santosh Kumar Naik. Your point of view on this particular queuing of mine.
Yeah. Actually, as I worked in various sector, like from the starting from my career from the hospital, then industry, research, and then in the hospital. So, in my perspective, the students should have the knowledge. They should be updated. Whatever the guidelines means, let's it will be like in the research, let's it be like in the sector of the hospital. Whatever there is every day and every year, there is the changes of the guidelines and there is changes in the system. They have to know the update about the regulatory guidelines. First thing. Second thing, they have to visit whatever the means all sector. And if there is and the course curriculum should be modified accordingly, so they can get more knowledge on this. And practically they will make, because one industry they will get the fresher with a experienced candidate, right? If all the students they know the guidelines and everything, so it will be better for the students, I think so.
Okay, fine. That's a fine answer from Mr. Santosh.
And
Now I would like to move
additional
towards,
also,
yeah,
additional also, Mr. Rahil, that
Yeah.
I hope that the students also will think that in today's generation, they have to install in their minds that today the pharmacist has no boundaries. As you can see now, we are having the webinar. And before, what you call this, there will be no boundaries. So they can go anywhere, and at the same time, they can practice what they will learn from the school, and also at the same time in the community. Thank you.
no, thank you very much, Professor Anthony. I will quickly move to Mr. Raymond Inamdar, sir, to put his points forward. Mr. Raymond Inamdar, sir, you can mute yourself and please come forward. And then I will move towards Dr. Yasir Ansari, and finally I would move towards Mohammed Tariq, sir. Mr. Raymond Inamdar, sir. What qualities should these students have in this challenging world which we are facing currently? If you are audible, hello? Zaimullah Inamdar, sir. I think there is a problem with this thing. I would move towards Mohammed Tariq, sir. Yes, please put some light on this, sir.
Rahil sir, can you hear me?
Yes, please. Go ahead.
So, nowadays, the students which are learning from the books, I think that books have written long back, either 10 to 20 years ago. So apart from the theoretical knowledge, they have to concentrate more on the practical knowledge. So the knowledge which they are getting from the teachers or either from the books, these books have written long back, either 10 years or 20 years ago. So side by side from the books, they have to learn from the internet, as well as either they have to physically visit various pharmaceutical companies as well as the various hospitals and pharmacy stores. So they will get actually right now what is going in the current medical field or in the current scenario. We can take the example of the COVID-19 pandemic. Apart from the physicians, surgeons, doctors, the pharmacists are playing the major role, because doctor, physician, as well as the practitioners, they are opening their clinics for the treatment. But apart from that, the pharmacists have opened the medical stores 24/7 in a day. So 24 hours they are providing the service. So this is the main situation. The students have to be motivated. They have to learn from the books as well as from the sources which are available right now.
Yes, thank you, sir. And Mr. Rahil, I want to discuss one point.
Yes.
Like in the curriculum, what I said, even if you can invite the guest faculties from the industries, or which is more beneficial them, better it will be in the final year students. So it will be more, they will be more focused on that in different sector, not only the production, not only the R&D, in different sector, whatever the industry. So there is weekly one class or everything. So it will be motivate them to choose their professional, to choose their way, and which way they can be, means they can see in the next year as a professionalism.
Yeah, of
So
course. A very, very excellent point raised by Mr. Santosh Kumar Naik, and an excellent explanation by Professor Mohammad Tari, the principal of the college. Now I'll move towards Professor Dr. Ansari Yasir Ahmed, who is also one of the senior most faculty in our college. And Mr. Ansari Yasir, please answer this particular question, that what the student should have.
As already told by our respected principal sir and other keynote speakers, that in current era, a student should have practical knowledge with the theory. As students are going towards the theory knowledge nowadays, they should have a practical knowledge, and they should gain some soft skills during their study, during their training. They should have different skills, communication skill and other skills. Communication, they should correct their behavior, character, conduct, how to deal with the patron, patient, fellow pharmacist, and other uh, person who whom the pharmacist is dealing with. To whom for pharmacist dealing with the person, pharmacist, the anyone for means pharmacist should correct their behavior, character and conduct from whom he is dealing with. He or she should gain some knowledge, some skills, and other quality from their seniors, from their environment, and should apply in their practical life. That's the point.
Thank you. Thank you very much, Dr. Yasir and Professor Anthony, Mr. Santosh Kumar Naik, and Professor Mohammad Tariq sir. My conclusion before handing over to Professor Mohammad Tariq to felicitate our guest members and other students and all. My conclusion to overall conclusion on this particular Pharmacist Day with the experts, I'm here and I'm not concluding. I'm not adding something from my side. I'm just having the bits from the experts over here. That is Professor Anthony, Mr. Santosh Kumar Naik, Mohammad Tariq sir, and Dr. Yasir Ansari. That's the pharmacist or the coming age pharmacist, the future students who are right now studying and who want to really become a good pharmacist and who want to achieve pinnacle in their life. As pharmacy is a noble profession and it is something that you have to serve the society. Okay, you have to make your career. That's a good thing to have, but it is more like a humanitarian service, which I can understand. You have to serve the society, whether you are becoming a retail pharmacist, a community pharmacist, a hospital pharmacist, or even you are into teaching or production or any other sector. Basic pharmacy or medicine service is basically a community service. It is basically a noble cause. So for that, and according to this current situation of pandemic, all students should acquire the adaptability kind of skill. Like you have to be adaptable in any kind of chaos, any kind of pandemic or any kind of situations like this. And you have to be a continuous learner. You have to learn continuously. That's what my conclusion was here. And now I would like to invite Professor Mohammad Tariq again, who is the principal of Jamia College of Pharmacy, to felicitate and give the vote of thanks to overall panel members, to the joining the participants, and specifically and especially to the eminent speakers, keynote speakers. All over to Mohammad Tariq, sir.
Sir, first of all, a very happy Pharmacy Day to all the participants. Then I would like to thank our management, Jamia Islamia Aishatul Ulum Akkalpua, for providing us platform to organize such a nice program on this occasion. Then I would like to thank Mr. Anthony Martin Rios from Saint Dominic College of Asia, Philippines, for joining us and having a very knowledgeable session with us. Thank you very much, sir. Then I also would like to thank Mr. Santosh Kumar Naik, sir, for sharing such a nice information as well as guidelines with us for COVID-19. And lastly, I would like to thank organizers, especially Mr. Rahil Khan, sir, the convener of the today's program, and as well as academic head of the Jamia College of Pharmacy, and co-coordinator Mr. Ansari Yasir, sir, who is the head of the exam department from the Jamia College of Pharmacy. And lastly, I would like to thank all the participants for joining us in today's online session. Thank you very much, one and all.
Thank you very much, sir. And here we would like to, because I didn't want to stretch the session, and I guess we had almost started with the time. There was a bit of technical glitch as the link. We are now living in a virtual kind of world, so there are technical glitches. Like YouTube links sometimes it didn't work, and that's what we have to change the streaming. But I think which is all is well, all that ends well, it is well. And thank you very much to all the eminent speakers and all the participants. Have a wonderful day, have a happy Pharmacist Day today, and have a beautiful life ahead in your future. So thank you once again, sir. Thank you very much.
Thank you all.
Thank you very much. Thank you, Jamia College of Pharmacy.
Yeah, thank you, Professor.
And thank you all participants. Thank you the Jamia College of Pharmacy. Thank you the management. Thank you the coordinator, and thank you Mr. Rahil. And wish you means World Pharmacist Day, and Jai Jagannath.
Thank you very much to all of you.
Okay, bye for now.
Bye for now. We'll meet again.
Bye.
Yeah, we will definitely going to conduct some other webinars as well for our students, and would like you people also to give some expert industrial talk from your end. Thank you very much.
Thank you very much.
you.
Okay, thank you.
Thank you.